All right, so we're going to take a look at hyperkyphosis. And hyperkyphosis is a postural, predominantly a postural issue that's super, super, super common. I would say I see it in approximately, depending on the client base that you serve, I would say approximately 70 to 90% of people have it. Would you say? Yes. I hardly see anyone who doesn't have it, but if you see someone with beautiful, upright, proud posture, and they're not slumped over, they may be blessed without hyperkyphosis syndrome. Good morning. But most of us have succumbed to gravity in a hyperkyphotic way. I will say, and this is in your notes, that one thing though to really call out, well, let's first talk about the basics. Hyperkyphosis is when we have, good morning and welcome, we have an excess in the kyphotic curve of the upper back. So this area, of course, where the ribs attach, so the rib cage area has too much curvature. And along with this, if you assume what you might be already in, like a kind of a slumped posture, let's say if you slump when you read or you're on your phone or you're on your laptop, let's all assume that posture for a minute. And you can work with one or two people next to you and figure out, in addition to that extra curve in the upper back, what else is going on in this position? Let's take a moment to look at that and think about it. This is one reason why with that shoulder forward and that so many of your clients have really jacked up teres major and minor. So that's one of those areas that your clients often don't notice till you touch them. It's one of those areas where they'll think you're a magical being for understanding that that area of them is messed up. But it's going to be messed up, right, as soon as they throw themselves like this, which almost everybody does when they're on phones and laptops. Yeah, was there something else, Taylor?
Just had a question. So if you're constantly kind of like slumped forward,
does
that have any impact on like your lungs' ability to like fully inflate?
Yeah, definitely. Good observation. Could you grab me a couple ribs?
Of course.
So yeah, it does. Ha ha ha. Our owl's not so. Owl, look at the skeleton. Let me do it this way. I thought there were a couple ribs there. Yeah, so the rib cage, I'm so glad you brought up the rib cage. The ribs are supposed to have multiple different ways that they move. And one of the ways is, this one's broken, so it's hard to decide which way it's supposed to go, but it's this way. So one of the ways they're supposed to go is up and down like this, which is called a bucket handle movement. And they're supposed to all be able to do that. And then in the front, this is supposed to, of course, be able to go out and up, right? And then they should also be able to expand downward. And they should also be able to go backwards. So it's all moving and opening at once. But of course, when we're all slumped like that, and we have the tight pecs and all the other muscles we talked about, serratus anterior, right? Then they definitely get compressed and not expanding as much. And this is actually often also accompanied by these first rib. We get less movement up here often. Next week with thoracic outlet syndrome, we'll focus more on the scalenes, and we really get significantly decreased motion here. And then a lot of people end up doing like upper chest breathing. So they end up overusing the poor little scalenes that are pulling on the upper muscles, and less use of the diaphragm and the expansion here. So this gets seriously jacked up in almost everybody. Yeah, for sure. Any other muscles we want to talk about or patterns? I saw y'all like pointing to this area when you were working together. What were you thinking was going on there? Was that part of your discussion? Were you talking sternum? Oh, pecs?
Yeah. Ribs and just the chest.
Ribs, chest, pecs. Good, 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 good. Well, that brings us to the upper cross syndrome. And again, this pattern is so common that lots and lots of folks have this upper cross syndrome. We want to look oftentimes at massage therapists, what muscles and fascia are short and tight, which we can see the cross here of what's short and tight is on this angle, and then what is long and weak is on this angle. And so, of course, with massage, we can lengthen what's short and tight. And it's harder to activate with massage what's long and weak. But we can use things like muscle energy techniques and any techniques where we're having the client actively use those muscles. So that's something that a lot of massage therapists don't take advantage of enough, is that you really want to wake up the muscles that are not doing their job. So taking a look at these muscles, does this all make sense? Why all of these ones here, pecs, major and minor, anterior deltoid, subscap, teres major, lats, serratus. You got most of those already, right? That these are all going to be short and tight, yeah. I will call out, right, that sometimes massage therapists will ignore serratus anterior. So that's another good one to make sure, right, that you get that open up. That's another good one for sideline, yeah. And then, like I said, next week we'll work with Scm and Scalenes. We talked about why the subox would be short and tight, and our rector spinae, our upper traps, our levator. Now, of course, these are also going to be prone to trigger points, right? These long and weak ones, we're not going to work like directly in the anterior neck, but we can have the client actively practice chin tucks. And so where they tuck their chin and then they bring their chin back will help with that head forward posture. Also active movements where they're rolling the shoulders out and back, not just to stretch their pecs, but to activate their rhomboids, right? Their middle traps and their rhomboids are going to be weak. So we want them to activate those. Yes.
Yeah, I just was having PT for this. And definitely one of the things that they have me do all the time is bringing in my arms and my scapula together to strengthen the rhomboids and everything in there.
Nice. Yeah. One that I like is like you're pretending like you're holding or you could actually hold a medicine ball, or you could just pretend to hold one. And then you just bring your arms back. And you want to really roll them back and activate your rhomboids. And I do this at the gym a lot, and also when I'm on a rowing machine or between sets when I'm doing upper body, just to make sure that because I also definitely roll everything forward, to make sure that you take time to really roll things back. And it takes practice to activate sleepy rhomboids and up and middle traps. You're doing a great job. Yeah. So far we've been focusing on functional hyperkyphosis, and I just want to call out the difference when we're talking about postural issues or structural issues. I want to call out the difference between functional and structural, both from a treatment perspective and also from your licensing exam perspective. So we've been focusing on the fact that all of these activities can have us in this posture. Also, like certain emotional stances and so forth can have us in this posture. But that's all functional, and that's all like soft tissues, right? And our fascia and our muscles and so forth. But just you should also be aware that sometimes it also becomes a structural issue. Some functional issues can become structural issues because there's changes in the bone. And sometimes actually the structural issue comes first. So when there are changes in the bone, like the actual shape of the bodies of the vertebrae and so forth, massage can no longer directly help with that part of it, but there's still all of those compensational patterns and so forth that we can still help with that part and the pain and so forth. Do you want to add anything at this point?
Well, and sometimes when someone is stuck in that position for so long, that's when those changes will happen. And it is, you know, we've all seen someone, especially someone older, who really is stuck in that position. And we were just chatting during the breakout in this area. If you work with a lot of people who work in the tech field, it may even be more than 90% of the people you see, especially those who are working at home, who may be at their dining room table or sitting on the couch. You know, they're all sitting on the couch like this, hunched over the laptops for 8-10 hours a day. So.
Yeah, and speaking of the people working from home, I mean, I've definitely seen, and I'm sure Jill has as well, with so many more people working from home since COVID, all the tech people, project managers, and so forth. You know, some of their companies will give them money to set up a better station at home, and some of the people with enough money have a good place to work. But a lot of them don't, just like you and I, right? When I had both of my kids Zooming from home at the same time that I was Zooming from home, and we don't have offices, and so we're all in makeshift spaces. And so, I mean, I massage people on the regular who, despite their good jobs, are doing the same thing. So I massaged a woman who's all jacked up because, you know, her office is at the kitchen counter for 8 hours a day, right? So I see a lot more of this these days even. So any questions, comments before we go on? Yes.
I fetal sleep. I've talked about that before, like staying like this for however many hours of sleep I'm getting, holding pillows and stuff. And I know when I wake up a lot of times that my shoulders are.
All right, so we're going to do some awesome work in the lab today. Again, I want this intro to be short, but I want you to think about, like, when would you use these kind of treatments? Because almost nobody will come into your clinic and say, I have hyperkyphosis, can you help me with it? In fact, in 30 years, nobody has ever said that to me, right? Has anybody ever said that to you?
Never,
no, this is not what they're going to say. What's going to happen instead, occasionally you do have some people who are aware of their poor posture, or their PT or their doctor or their massage therapist has helped them make the connection that their problems are related to their posture. So they might mention posture, but they also don't always mention posture. Instead, they're coming to you for sometimes the run of the mill. Well, what kind of stuff do you think they complain to you because of this causing? What do you think they're coming in and saying to you?
It hurts to turn my head.
Yep.
Very good.
Awesome.
Stiffness, yeah.
What's that?
Stiffness.
Yep.
Stiffness. Excellent. That could be back pain, neck pain. Awesome.
Yep.
That's
Like their chest is tired.
My shoulders keep
That
popping.
honestly is rare. That, I mean, to me, that somebody says my chest is tight until I start working on their pecs, and then they're like, oh my, that is so tight.
Yeah.
I don't know if that's your experience too, but it's not often.
Yeah, a lot of people don't notice the pain in the front. You know, it's really
Like,
interesting.
not like necessarily your
Pain,
but like the
tightness.
crease, like where
Yeah.
your shoulder meets.
Boulders are tight.
Nobody has ever said that to me, but
Tightness between the shoulder blades. So, you know, what's interesting that there's a little discussion sort of bubbling up about here is that, you know, with the rhomboids being overstretched and weak, in this situation, they're the ones that are sort of being bullied by the pecs. But what's interesting is people don't usually notice the bullies. What they usually notice is a lot of soreness and pain and tightness back here. And they don't usually notice that the problem is arising from these ones being too tight and these ones being too weak. So yeah. You guys got a lot of them. And then there was a question about breathing, right? So sometimes they also notice like constricted breathing, right? And that it's, bothering, it could even be causing other pain, right? Other problems downstream. So this could include, like, we're going to move on in this next weeks to thoracic outlet syndrome and carpal tunnel syndrome. And all these other things can all be related to this upper cross syndrome and functional hyperkyphosis. So this one really goes with between 70 and 95% of your clients, right? So this is the kind of thing where you don't even have to do a formal postural assessment. And I just walk people back to the room, and we were having a quick little conversation, and you can already see like how they're standing, how they're sitting, what their activities are, so forth. And you're like, I can see what's going on there. And then you can work that. Yes. Are you stretching,
Stretching.
Anna?
Another thing that it can cause is TMJ issues.
Awesome, thank you. So Anna also brought up TMJ, any kind of jaw tightness, even headaches, right? So the person may complain of headaches, they may complain of jaw issues. And again, right, because that's often combined with the head forward posture, is now putting additional stresses on all of those muscles. Excellent. All right, and so last little point to kind of touch on briefly, and we'll see this in the lab, is that, of course, we may have more trigger points going on with this. So part of what we're going to be treating is the trigger points. And of course, we have fascial issues with this. So we're also going to be treating the fascia. So that's kind of where we're going. I'm going to pause this beginning.
It is very important when you are working with someone that you engage them to take responsibility for improvement in their health, because this is not a one-time 60-minute massage and everything is rainbows and puppies forever. This is something that developed over a long period of time, and it takes time for it to improve also. So on your treatment sheet, there are some suggestions of things you can work with the client on, and really help them be accountable for that. And just kind of circling back to the cupping that we have done over the last few weeks, beginning that cupping on the scapular positioning muscles. Part of the reason we do that is because many of the issues with neck, arms, hands begins with the scapular positioning muscles. So that's kind of tying it all back together. So
Awesome, Jill. Yeah, thanks. And whether it's cupping or other things,
yes,
part of that with the scapular positioning, right, is part of the thing with these postural issues is that they become so ingrained, it becomes the normal for the client, right? Mm-hmm. And that can feel like the best way to sit, the easiest way to sit, that any other way to sit is, not only a lot more work, but actually impossible. Because of the fascial restrictions and trigger points, instead, until we help make some changes, they can't really just force themselves to sit up, right? Mm-hmm. But we are doing some retraining so they can even experience, their shoulder not medially rotated so far and their scapula not protracted so far, right? To give them an opportunity to even experience that. Yeah.
It becomes an unconscious behavior.
Yep, for sure.
Yep.
For sure. And I find with massage, like Jill is saying, 100% is true for them to take some responsibility. And it's part of our job to kind of like communicate with them but also for them to even experience anything different sort of opens up an opportunity for them to feel it in a different way. But then they have to do the stretches and exercises to start experiencing their shoulders in a different way. Yeah. All right.
A lot of people call this tech neck. So that phrase you'll hear from people who work in the tech field is, oh, I'm afraid I'm getting tech neck or something like that. And they are. So there you go.
All right.